So I have also had the great honor to work with Igho through a clinical trials network that David Stevens and Monica and I led, and Kathy Edwards was a big part of that group, and he led the mentoring group for that network. And Igho, this may be the wrong thing to say in front of a room full of people, but I have never heard Igho say no to an ask that is related to mentorship or developing the next generation of scientists. You're humble. You are generous with your time. And again, please come forward to accept the Maxwell Finland Award.
Wow. First and foremost, I want to express my heartfelt gratitude to the National Foundation of Infectious Diseases for this incredible honor. A special thank you to Kathy Edwards for your confidence in me and for nominating me for this award. Your support means the world to me. I must also extend my deepest appreciation to my family, my wife, Leanne, and our 3 wonderful children, Claire, Rachel, and Nathan. Your unwavering support over the years has been my foundation, and I'm truly grateful for your love and encouragement. To my esteemed colleagues at Emory Infectious Diseases Division, a truly exceptional division, many of whom are here tonight to celebrate with us. Thank you for fostering an inspiring environment that has allowed the field of infectious diseases to thrive. Your collaboration and your support have made all the difference. The truth is that I never saw this coming. Like many of my colleagues at Emory, I showed up daily to do my work and did not imagine that my contribution will one day rise to this level of recognition. As some of you may already know, my journey to this point has been somewhat unconventional. I became interested in medicine early in life. It was in my 5th grade, back in Nigeria where I grew up. I was about 11 years old, and we were studying the history of West Africa. And my teacher then was Mrs. Ogedegbe, an amazing teacher. It was a dark and gloomy period of slavery with massive displacement of blacks and unimaginable suffering inflicted to millions of people by their fellow humans. Yet, in this darkness, there were also flickers of hope and goodness. Men and women of goodwill emerged, advocating for the end of this horrific injustice. Many recognized the urgent needs of the region and established schools, hospitals, community centers, addressing diseases born from poverty and poor hygiene, illnesses such as cholera, dysentery, malaria. This experience ignited in my young mind the revealing medicine, especially infectious disease, as a powerful tool for good and a way to serve humanity. When I officially became a physician in the early 90s, the AIDS epidemic was ravaging the African continent, As a young medical officer in the Niger Delta of Nigeria, I witnessed firsthand the devastation. Treatment was often limited to managing opportunistic infection, and AIDS diagnosis was almost synonymous with a death sentence. While stigma often prevents men from seeking care, many women came forward, driven by a fierce determination to live for their families. Tragically, most succumbed, leaving behind orphan children. This experience made a lasting impression on me and provided a sense of purpose that has been the driving force behind our domestic and international HIV/AIDS effort. Through Team Science Team Science approach, our effort have focused on promoting healthy aging in those living with HIV, particularly vulnerable populations, women, children, individuals with limited means and access to care. This audience undoubtedly is familiar with the remarkable advances in HIV disease management over the past 4 decades. As a result, life expectancy for people living with HIV have significantly improved. However, with this tremendous success has emerged new sets of health challenges, notably the premature onset of aging-related comorbidities, such as diabetes, hypertension, cardiovascular disease, chronic kidney disease, and bone disease. Once again, it is women, people of color, individuals from disadvantaged backgrounds who are disproportionately affected. Why the gap in overall life expectancy for people living with HIV has narrowed relative to the general population, the disparity in comorbidity-free life expectancy persists. Persons with HIV live, on average, 16 fewer healthy years than their counterpart without HIV. Moreover, we are starting to recognize that this phenomenon is not unique to HIV. We see similar pattern emerging with other infections, as exemplified by the ongoing challenges following the acute SARS-CoV-2 infection and long COVID. This gap represents a new challenge for the infectious diseases discipline. We must manage all infection effectively during the acute phase. Our work cannot cease there, however. We must innovate management strategies to reduce or even eliminate the risk of post-acute sequelae or infection-related chronic conditions. Over the past 2 decades, our team has devoted itself to this mission in the context of HIV and most recently SARS-CoV-2 infection and long COVID. Our work has centered around the understanding of the pathobiology of this condition in order to identify targets for preventive and therapeutic intervention. We have extended our reach beyond Emory and the US, working with some of the most vulnerable communities around the world. Additionally, we have actively leveraged our platform to attract and mentor the next generation of researchers, ensuring that this vital work continues both here in the US and in sub-Saharan Africa, where the needs are most pressing. Finally, I am profoundly grateful to the Foundation for this once-in-a-lifetime recognition. This honor is a recognition of the cause to which I have devoted my life for the past 2 decades. It is a tribute to my remarkable team, the Emory Rhythm Research Team, who have worked tirelessly alongside me. It is a recognition of the HIV community, women living with HIV, who have been my inspiration throughout this journey. It is a recognition to influential mentorship by incredible mentors along the way, including Dr. Francis Collins, the immediate past director of the NIH, Scott Emakwo from my medical school, Claire Pomeroy, David Markovitz, Carlos Del Rio, and Jeff Lenos, to mention a few. A recognition to my family, my wife for nearly 30 years, my 3 children, my elderly mother, and my late father, Chief John Ofotokun, for their unwavering belief in me and their steadfast support throughout the years. Thanks to all of you for showing up tonight to celebrate with us. Thank you.